Okay, good morning, everyone. We are on the record. Today is Friday, the 24th day of July in the year 2026. This is a budget hearing for the Department of Health and Human Services with the Jersey City Municipal Council. We had a scheduled 10 a.m. start. The clock on my cell phone is showing 10:04 a.m. May we have a roll call for the commencement of this budget hearing? Councilperson Brooks. Here. Councilperson Zupa.
Here.
Councilperson Efros.
Here.
Councilperson Little.
Here.
Councilperson Gilmore. It's not here. Councilperson Singh.
Here.
Councilperson Griffin is not here. Councilperson Navarro. Not here. Council President Ridley.
Here.
We have 6 council members in attendance at 10:04 a.m. In addition, at its time of its preparation, the notice of this meeting was similarly disseminated on Friday, July 17th, 2026 at 3 p.m. to the Mayor, Municipal Council, Business Administrator, Corporation Council, and local newspapers, so I can certify as to our total compliance with the Sunshine Law. And I see Councilperson Navarro walking in at 10:05 a.m. So we now have 7 council members present at 10:05. Council President, I'm going to turn it over to you.
Okay, good morning. Day 4 of our budget hearings. And this morning we are reviewing the Health and Human Services budget. We have Director Green here and some of her staff. This budget hearing will be overseen by our Councilman Joel Brooks. So I am going to hand it over to him.
Thank you, Council President. Good morning, everybody. I think we have a good kind of format going, which is where the department does their slide presentation. And then we can ask some questions based on the slides. And then we could proceed into the line items. Does that work for you? Okay.
Oh, keep it here, yeah.
Yep.
Yes, that works for me. Thank you.
Okay, excellent.
Well, good morning, Council President and City Council members. I'm before you to present our budget for 2026. But before I do that, I would like to go into just some opening remarks and some discussion about what the Department of Health and Human Services, the services that we perform, so that everyone's aware of the scope and the breadth of our work, if you don't mind. Health and Human Services serves as Jersey City's local public health authority. Our responsibility is to protect the health, safety, and well-being of more than 300,000 residents through an integrated network of public health, environmental health, human services, nutrition programs, emergency preparedness, animal care and control, regulatory oversight, and grant-funded initiatives. Our work is rooted in prevention. Success in public health is often measured by what does not happen. The crisis that we sort of avert, diseases that are prevented, outbreaks that are contained, environmental hazards that are corrected, and children who avoid lead poisoning, seniors who remain healthy and independent, and residents who receive help before crisis occurs. So, as director, it is my role, my vision to just ensure that the Department of Health and Human Services serves as the Jersey City's chief health strategist by bringing together public health, healthcare, public safety, nonprofit organizations, educational institutions, and community partners to improve outcomes, reduce disparities, and ensure every public dollar delivers measurable value. So I will begin with the scope of the department and the residents we are responsible for serving. Our core service areas are the functions that we must perform and are state mandated. That includes the Division of Community Health and Wellness, our communicable disease, environmental health, and those are the ones that are not optional, municipal services, but they're state mandated. and animal care and control. That's right. Our other areas that we cover are human services, food and nutrition, and our grants and partnerships. Community health and wellness focuses on prevention through health education, chronic disease initiatives, screenings, wellness programs, outreach, and community engagement. Communicable disease conducts surveillance, investigations, prevention, testing, emergency preparedness, and coordination when reportable diseases or outbreaks actually occur. Environmental health protects residents through food inspections, lead prevention, vector control, nuisance investigations, licensing, and enforcement. These functions ensure that the places where residents live, work, learn, and eat are actually safe.
Sorry, Sean, I think we're on the next slide at this point. Thank you so much.
Only do so much.
False accusation, I apologize.
Human Services supports seniors, veterans, residents needing transportation, and people requiring resource navigational social supports. Food and Nutrition addresses maternal and child health, senior nutrition, food insecurity, Meals on Wheels, WIC, and summer meals. Animal Care and Control protects both public safety and animal welfare. Grants and partnerships expand the department. To be like, okay, good, okay. Can everyone hear me now? Great, okay. Grants and partnerships, as I was stating, expand the department's capacity by bringing federal, state, county, and private resources into Jersey City. Although each area has distinct responsibilities, residents often need more than one service. Our responsibility is to improve coordination so that residents do not have to navigate government in fragments. With that context, I will highlight what the department has accomplished and the resources we have brought into Jersey City. What we've accomplished so far. We have already, within this year, we've received approximately $8.4 million in active external funding. These dollars support nutrition, senior meals, childhood-led prevention, opioid response, environmental monitoring, disease prevention, wellness, family services, and other public health priorities. This funding allows Jersey City to provide services that the municipal operating budget could not sustain on its own. It also demonstrates that we're sort of actively leveraging some outside resources as opposed to depending solely on city dollars. We also began laying the groundwork for a more coordinated behavioral health response, expanded partnerships related to homelessness and linkage to care. We're improving grant oversight and strengthening internal expectations for fiscal accountability and program performance. The important distinction, well, actually, before we began laying the groundwork for the behavioral health responses, we started looking at ways to partner more with all of our other additional partners and creating more of a coordinated effort and being more responsive and looking at actual best practices. The distinction in some of our funding is that some of our funding is restricted in funding. It's not flexible that we can move to cover any and all departmental needs, and the awards are sort of specific and descriptive. Each award must be spent for its approved purpose and managed according to its own requirements. Next. The budget that you see before you is what the proposed budget was for 2026. Actually, and our reduction, we reduced it from what we proposed to what it is actually now by 34.8%. A reduction of this size is just not absorbed through minor administrative adjustments alone. It affects personnel, contracts, supplies, program capacity, response flexibility, and our ability to address emerging needs. My main responsibility is to manage within this budget and ensure that services for our residents, our core services are maintained. Next slide. Public health is a workforce-driven service. So inspectors, nurses, health educators, nutrition professionals, outreach staff, drivers, clerical personnel, fiscal staff, animal control personnel, and program managers are the people who deliver our services. The salary and wage allocation that was reduced by 2.13 million, that amount must now support the remaining workforce after all of the throughout our fiscal restructuring. Their responsibilities are now being redistributed. There are some operational capacities that have been reduced. Hours of operation have been reduced. And all of this is because of the available staff that we have left and operational priorities. Cross-training can support some of the continuity, but it doesn't fully replace the capacity, experience, or time represented by those positions that are no longer with us here. Operating expenses support the practical cost of delivering services, including the contracts, supplies, equipment, transportation, program materials, technology, facilities, professional services, and other expenses needed to operate the 10 different divisions. We will continue to prioritize legally required health and safety related and mission critical expenditures. However, a reduction of more than half limits our flexibility, affects program reach, and reduces our ability to absorb unplanned costs or respond to changing conditions. Staffing considerations. The replacement, there's no opportunity here for us to replace our employees. And so basically we have reduced all of our staffing. Our hours of operation for licensing is now by appointment only. Our senior affairs trips have been cut for out of town and now are just in town only. Our city clinic I've had to reduce the hours, and there are no more evening hours for our city clinic because of the reductions. So this is just letting you know this is what it is now. This is the only way that we can operate with those staffing vacancies. What we've already implemented. So basically what we've done is shown the efficiencies and cost containment measures that are already implemented. We have reviewed contracts, reduced discretionary spending, eliminated non-essential expenditures. We've consolidated responsibilities, transferred personnel to areas with the greatest operational gaps, and adjusted operating hours, as I stated before, where staffing no longer supports the prior service models. We have strengthened our fiscal review. We've centralized purchasing controls. We've increased grant oversight and required divisions to prioritize their expenditures directly connected to public health, legal mandates, and resident services. These actions are sort of demonstrating that we've already implemented some cost containment. We are not approaching the budget discussion without first making difficult internal adjustments. Going forward, we will continue to evaluate shared services, regional partnerships, and management consolidation. But efficiency does not mean that every eliminated function can be absorbed indefinitely without affecting workload, timelines, or service capacity. So one of the most important ways that we stretch our local dollars is through our department's active grant portfolio. We have 21 active grants, each with separate terms, deliverables, compliance obligations, and allowable cost. And the active portfolio is rounded to about 8.4 million. The only matching funds that we had to leverage was $372,492, as it is shown here. Our largest active award comes through our WIC, which is our Division for Food and Nutrition, which supports nutrition, education, food benefits, breastfeeding support, referrals for eligible pregnant and postpartum women, infants, and young children. Our senior nutrition, as you see, it's 1.4 million, supports meal services for older adults and helps address food insecurity, social isolation, and healthy aging. Meals on Wheels provides meals and regular contact to homebound seniors who may be unable to shop, prepare meals, or attend our congregate sites. That's $845,000. Childhood-led poisoning prevention, $816,562, supports our lead investigation, environmental intervention, education, follow-up, and prevention of permanent development harm. And then we have our opioid settlement, $643,751, one-time restricted funding for approved opioid response strategies, including prevention, treatment, connection, recovery, harm reduction, and community response. And so here you can see our entire grant portfolio. We also have our Curry Woods Food Pantry, which was a one-time investment, supporting food security and community-facing barriers related to income, transportation, and access to nutritious food. That was $510,000. EPA, air quality monitoring, is $462,000. One-time funding supporting environmental monitoring in public education and future health protection strategies around our air quality. And we have a remaining 14 awards with $1,687,000. And that collectively supports disease prevention, wellness and outreach programs, senior services, family services, and other additional targeted programs. Every grant we secure brings resources into Jersey City without placing the burden on local taxpayers. However, grant funding is restricted, and so it cannot be used, as I said, indiscriminately. It has to be used for the purposes in which we applied for. Managing 21 grants also requires qualified staff, right? We must maintain documentation, meet performance measures, submit reports, manage reimbursements, monitor contracts, and remain audit ready. Grant revenue expands capacity, but also creates administrative and compliance responsibilities. So in addition to the active awards, we're constantly looking forward to potential funding, which can support our department even further. Thus far, we are looking at additional opportunities in development, and we're looking at for about 1.9 million. Up to awards, we are looking at applications. There are applications that are due, that are upcoming and due like Monday, that we're working with our grants team with. And so a lot of it is around chronic disease, overdose prevention, behavioral health, mental health, and of course, our domestic violence program, public health infrastructure, our WIC opportunities, and as well as summer food service programming and the Mayor's Alliance to End Child Hunger. These are in the pipeline now, and it's just showing that we do have a deliberate strategy to align outside funding with all of our core activities and our public health services. So this is where our future strategy is. We're also looking at joint applications with public safety and combining our work that we're doing with mental health and social services. So now as we transition and looking ahead, as we look ahead, our focus is building a department that is proactive rather than reactive, better integrated across public health and human services, strengthening resource navigation through the development. I'm looking to develop an Office of Social Services, which would actually integrate and coordinate assistance with housing, food, benefits, transportation, behavioral health, employment, and other social service supports. We are also expanding and have started expanding our homeless outreach component through stronger nonprofit partnerships and collaboration. We're looking at also providing social service, social work on board our Ruby bus to engage with the community when they are out in our community where there are the homeless population, the unhoused population are concentrated. So we're looking to expand on those partnerships. Looking also into building a community stability framework, I call it, which will bring together our public health, public safety, healthcare, nonprofit organizations, and government partners to respond more collectively and more effectively. Because everything that we're touching is human services and health. And if we can have a sort of a stability framework around that with the other departments, other organizations, with organizations that are already doing the work, we can become more effective as a complete community. Our reach will be expanded, and we will be in a more organized and coordinated fashion. Sometimes we end up working in silos, and it's about bringing that work collectively together and doing greater work.
Excuse me.
Above all, our work will remain guided in health equity. Every decision that we make should help reduce barriers, improve access, and create healthier outcomes in every neighborhood of Jersey City. So I close by basically going to the central message, which is public health is both an essential service and a strategic investment. This is something that we cannot go away from. It affects every one of us. It affects every part of our lives. And our department touches every part from birth to the end of life, to our aging population. So as we continue to manage responsibly, prioritize mandates and essential services, we will continue to pursue outside funding and reorganize operations where appropriate. At the same time, I have the responsibility to be transparent that the reductions in personnel and operating resources have affected our total capacity. And so that's just being transparent. But despite the challenges, we're going to remain optimistic. We're going to go get through it because our dedication is to our employees, but also to our community. So with that, I'm going to close and say thank you.
Thank you so much, Director, for the presentation. Before we go into questions on the slides, I just wanted to take chair's privilege and say, just respond to one of the things you said, that a lot of the work that you and your employees do is prevention. And as opposed to, DPW, where you see physical improvements out in the street, the work that you and your staff do, we might not see. But it does not go unnoticed. And just one small example, I was at the World Cup final on Sunday, and I ran into Director Bellenboyer, who had a health inspector looking at one of the food vendors, not for any particular reason, but just in the normal course of business. And that's to make sure that our residents are safe and healthy. There were, I don't know, maybe 1,000 people there, and your staff was there on a Sunday, making sure that the food and beverages that people were consuming were safe and healthy. So I just want to say thank you. One other remark, we received an email this morning from Senator McKnight. She held a meeting yesterday in the evening with some seniors in Ward B. I attended as well. One of the main concerns they had was the reduction in senior transportation. And before I asked my question around that, just wanted to note for the public that's watching, the employee census that we received for this department has 140 people. And of the 31 provisional employees that were laid off, 8 of those were from HHS. So numerically, it was the highest number. And, noting your remarks on the reduced capacity, So I guess my first question is, could you speak to how the senior transportation program works? How many employees it had maybe at its height, and how many employees does it have currently?
Thank you, Councilman. Just so you know, we previously had 2 bus drivers. One bus takes everybody shopping every day, food shopping to downtown ShopRite. The other bus takes them to out-of-town places such as Walmart, flea markets, restaurants, and all of that. We had 2 drivers in the beginning, and one of the drivers had been calling out sick. She worked 4 days this entire year. So we had somebody else that we brought in that should have been transferred over, wasn't. That person was laid off. So we had to decide between canceling the outside trips or the shopping trips, and we thought the shopping trips are more important. However, we are reimbursed from the county, $30.80 for every person we take shopping. So the first 4 months of the year, I went just for the outside trips. We were reimbursed $30,000. So we'll be losing approximately $6,000 $600 a day. And with this cut, also next month, the other bus drivers out on vacation. So we will have no shopping for the seniors for 2 weeks. Because you need a special CDL with a passenger endorsement license. So we technically had 3 bus drivers, 1 never showed up, so we now have 1. So this is very important to the seniors. The seniors are all upset because some of these seniors, the only time they really get out.
Thank you, Director. Yeah, and Senator McKnight and I were talking that we're going to be in touch with Commissioner O'Day, and I'm sure a lot of the residents were from Commissioner Celeste, not Commissioner Walker, from District 3. So we'll be talking on the council how we plug those gaps, but I appreciate you explaining exactly what the need is. And we heard that directly from the seniors last night.
Councilman, may I jump in here?
Sure.
Residents in Ward D in the Heights at the Connor Center brought this to my attention, and Director, I appreciate your invitations to come down and join events at the Connor Center so I can check in with those seniors all the time. And they were just really, really disturbed by this layoff, cutting the capacity of these trips in half. And it's a $60,000 salary that was being requested. It's about 1.5% of a 1% difference in the tax increase this year. So it's just hard for me to wrap my head around the decision, especially when this was being reimbursed so substantially from the county. So I would just ask the administration to explain some of the thought process behind this layoff in particular, in addition to just targeting a number of layoffs in Health and Human Services beyond this 1 bus driver, and whether the administration is considering this decision so that we can restore capacity for our bus trips.
Sorry, BA. I had a similar question. So if you can just also answer this with my colleague's question, which is what went into the decision-making process to fire our bus driver when he was not the last person or the most recent hire making a similar salary?
I will speak to Health and Human Services, also generally speaking for all of the department decisions that we have made related to the provisional layoffs. First of all, I think it's always really, really hard to make these staffing decisions. We don't take it lightly. We had many, many weeks of discussions with department directors internally to discuss the impacts this would have on internal operations and external services. We are unfortunately in the budget situation that we're in, that we had to make these hard decisions. We focused on provisionals because of the nature of civil service. And again, we worked with the departments to get input, and then ultimately we had to make the decision as a city. We take your questions and thoughts and opinions on what to prioritize through these budget hearings. And I think this is an opportunity for the public as well to voice their priorities and provide their opinions on what is important and how the city should be making those financial decisions. So, we can speak specifically about each line item, but that is the general answer in terms of how we came to these decisions.
So just to answer my question, can the administration speak as to why our bus driver was let go as opposed to the most recent hire, who, by the way, is a friend of mine, and I'm not saying he shouldn't be part of our administration, but I'm not going to tell my seniors they can't go on the bus because my friend got a job at the city.
I understand. I don't know who that specific employee is, but through our analysis, we were looking specifically for provisional employees.
This person's a provisional. He was hired with this administration.
Okay, we can follow up on that.
Well, can someone answer for me then? What does a principal organization specialist do?
That particular title, and I know exactly who you're referring to, that particular individual is basically doing more of a in-house clerical work support because of the nature of their business, cannot be actually engaged in all community work.
Yeah, he's in HHS when he owns he's a small business owner. Again, a friend of mine helped me get elected. But, again.
But a principal organization specialist would normally be developing programming, and that's not where that person sits.
Right. So again, I would like an answer at some point why we fired the bus driver for our seniors and hired someone who's sitting in-house and unable to perform more of the jobs that he's able to do. I'm not picking on him. He was just the first person I saw. It actually worked out because he's actually outside the organization chart. He's in his own square here. And I haven't gotten a good response as to why our seniors can't go out of town to Walmart, but we can make these kind of hires.
If I may just add to that as well, which is, Ms. Choi, you said that this is an opportunity to voice our priorities and for the residents as well. So I'll make it clear that this councilman's priority is serving our seniors. And so if we're looking to restore jobs and positions, that's a top priority. Yesterday, was it Tuesday? The tax assessor's office, losing track of time here. And so there was, so it was Wednesday, I guess it was, yeah. That the assessing aid, and I think the tax assessor spoke to their ability to create revenue by doing these assessments and reassessing properties values, and how that creates additional ratables for us. And so I would add that as a priority, not just specifically assessing, but revenue generating positions that may have been cut should be restored as well. And so putting that on the record.
I remember exactly that conversation. And again, I really believe in this process of articulating how impactful these positions are and why it was so difficult for us to move forward with it. Again, if we were to restore those lines, those positions, we are looking to seek information from the council where to find the funding. What are we deprioritizing in order to prioritize this as part of this process?
Yeah, my mic's on. Understood. And just again, for the public, the total sum of the salaries of the provisional employees who were eliminated was 1.9 million annually. And so we're halfway through the year. So it's about 900,000. Before, I think Councilwoman Little, did you have a question or a remark?
I a couple questions, but you can finish what you're saying. Yeah, I don't want to.
Okay. No, I was not. I was just going to say in terms of keeping on time, why don't we have questions around the slides? And this particular department, I think, has 10 divisions. So there's a lot of line items. So why don't we try to save about an hour for the line items? So council members, do we have questions on the slides? Councilwoman Singh?
I have just general question. Is that okay?
I'll allow.
Councilman, thank you so much. Good morning, Director Green, and good morning, everyone. Good morning for the
Need to
presentation.
get up on your mic.
Of course.
Closer than feels comfortable. Yeah.
All right here. Good morning, Director Green. Good morning, everyone. Thank you for showing this slide. I remember meeting you few months back, and you said you want to reorganize health department. I believe there are 9 or 10 divisions. So the way you were looking at that, you'll be reorganizing and health department. Can you please talk a little about it? Where are we at?
Currently, we are just meeting with the law department and HR. So that's why I didn't bring that into the presentation, because we're just starting the process of going through titles, looking at job responsibilities, and making sure that we are doing things in order. So that's why I didn't bring it up. But yes, that would absolutely reduce the budget significantly by doing so.
Exactly. And you might be able to use a couple of employees for multiple department, multiple responsibility, I would say, right?
Right.
Okay. Councilman, one more general question.
I'll allow.
Your department, as we all know, lost 8 employees. How are you able to, were you able to, okay, let me rephrase it. So after those employees were laid off, 8 of them, were you able to cope up with the situation? Like, how are you dividing the responsibilities with the current number of employees you have?
What I had to do was take down licensing from walk-ins to now appointment only. So anyone who needs a license has to schedule an appointment. So, and this is at the busiest season. So I don't know how many they're going to get through, who's going, and I have Amanda can speak more on that, because that is going to greatly reduce the number of people who can get licenses. So there's been a reduction in hours of operation for the city clinic, because now it's just the nurse. There was a nurse and a program monitor who would stay in the evening. Security leaves at 5 o'clock. And so I can't have a nurse seeing patients by themselves and there's no security on site. So now that means the clinic must close, actually stop seeing patients by 4. So that would allow the nurse to then do the paperwork, finalize, and be done by 5 p.m. to be out of the building by 5.
Did you eliminate any service or any services?
I've eliminated hours. I've reduced hours of operation. So that will in and of itself impact the number of what we can do, of what we can actually accomplish. So with licensing, reduced out, only appointments only. City clinic, out no evening hours at all. It closes at 4 p.m. Also, health education, which is state mandated, a core activity, losing a health educator for one of the most, for vulnerable populations, Ward A, okay, in that community, and not having a health educator for Ward A significantly impacts. There are now only 4 health educators left for a city of over 300,000 people that speak multiple languages, that are diverse, that have significantly different health needs per ward. And so to be stuck with that and to be left with that creates such a gap in services. First of all, we didn't have 6 health educators covering 6 wards. We only had 5. So they were already covering Ward C. Now they have to try to, there's no possible way that they can actually effectively provide education to the level that they should be providing education when there are now 2 wards that have no dedicated health educator, which is, again, a core activity and state mandated.
Thank you, Director.
If I may, Mr. Chairman, to this question regarding the slides, specifically you talked at length, Director. Hi, by the way, I didn't even get to say hello. Good morning, everyone. Good morning. You spoke at length about the grant funding secured. This may be more of a to the business administrator. I see a lot of the lines say grant offset. Both the revenue and expenses for each grant reflected in this budget, and is it only for grants that are received and accepted as far as like, and then future grants, are they, if we haven't received the award, are they reflected in the budget?
Is it for a particular grant in question or?
General question about grants in general for
If
both
we have not
HHS, but
received-
across the board, I would say, right? Are they reflected within the budget, both the revenue and expense side of that?
So I believe it should be, but I'm confirming with the finance and they are shaking their heads, yes.
Answer is yes.
The answer is yes.
Yeah, the offset is, but the position higher for that is also reflected, is my question.
So we can look at and allow Linda to go through her spreadsheet, but I believe on the many of the grants, they're offsetting existing employees' salaries, but there may be a couple of grants that are fully funding employees.
Okay, it might be better, I mean, I know there's a line that says grant offset at the bottom.
Yes.
It might be better to put something in the justification or comments suggesting that it's offset by a grant that position, so we know exactly who we're talking.
Yeah, there's some notes in the workbook. For example, I'm going to pick on environmental health. There is under part-time, new hire, public health nurse, and it says 100% offset by a specific grant.
Okay, I mean, I'm looking at a couple of line items here in different divisions for HHS. Show grant offset, but then in the
So we
listing
could,
of salary, so it's just a question.
yeah. Brooke was just saying that we could provide a detailed information about employees who have a grant offset and which don't, and the percentage.
And any of the employees laid off, were they grant funded?
We are double checking that. I remember that is a information request from a previous department hearing. So we will provide you with that information, all of the professional employees who were laid off, whether or not they were grant funded.
Okay. Staying on the question, you mentioned in the same slide with the grant information, behavioral health infrastructure, partnering with different divisions, public safety, et cetera. Is this the ARRIVE program? No. Well, what's your, does HHS have a role in that?
We are actually going to partner with them, and we will be working with them with the ARRIVE, but we don't have the dollars. That would sit with public safety.
What's your role in that?
It would be more in the social service capacity and trying to support by having those people that can navigate social services, connect the people to resources. We're still working out the framework, so I'm meeting with public safety weekly on how we can better work together in coordinating some of our services and ensuring that the ARRIVE officers are coordinating with HHS And so once I can build my Office of Social Services and put people in those positions, then they would work in tandem.
Okay.
Okay?
I may, anyone else on Grant, on the slides?
Oh, I have general questions if the chair will allow.
Yeah, Councilman LeVar, I want a couple more and then we'll
Yeah.
go to another council member.
On the slides, again, there was a reference to the opioid settlement, $643,751. And that money, that is reflected in this budget, it goes as grant awards, right, to different nonprofits or other organizations?
So the opioid settlement money was part of the mini grants that we micro granted out to nonprofits to perform STEAM education for youth development. And they are ongoing.
Right. My question is, are they contained within our budget? And maybe this is more of a, again, finance business administrator, and if so, where do they reside? Are they in certain line items, or expense line items? Or are they in a whole other area completely?
You're referring to the opioid settlement funding, is that right?
Correct.
Okay, I'm going to let Danny explain.
Hello, Councilman. What I can say is that as you go through these worksheets and you see there's a grant offset, whatever is 20,000, 15,000, and so forth, those amounts have been confirmed by the director. So those amounts were actually put into the budget to offset that respective division. Now, if there's any grant that's outstanding and we have not received it as yet, it's not reflective in this budget. But once the director has that information, she will pass it on to the finance department and we will incorporate that information. But as you can see, whatever you have in front of you,
Did anyone else see it in their budgets, the opioid grants? So they're grant awards to other nonprofits, similar like CDBG grants would go out, and CSBG and so forth to other nonprofits. Do they find their way in our budget as some sort of expense somewhere? Is it in the departmental budgets, or are they, I don't know, I'm just trying to figure out where they are.
I'll follow up maybe.
Yeah, we can follow up with that specific question and I can get back to you, Councilman.
Council Member Little.
Great. Thank you so much. So I have some general questions. When the mayor put out his top line budget overview earlier this month, we saw that Health and Human Services was going to have the largest cut of any department at that time. It was listed as 2.8 million in cuts. And I was absolutely ready to breathe fire at these hearings because, like they say, an ounce of prevention is worth a pound of cure. So, and you are a preventative services department. And here I'm seeing in your budget that it looks like the cuts from the 2025 budget is actually not 2.8 million, it's 673,000. Is this spreadsheet accurate? And why is there such a large discrepancy between this spreadsheet and what the mayor put out earlier this month?
What you're actually seeing is the 2025 adopted budget. And then the 2026. So that's the difference.
So this slide,
Right.
department requests is a 2026 request from Linda, right? The draft budget is then what the administration reduced, and that's the percentage that is shown here, versus what the mayor may have presented was comparing it to the 2025 adopted budget.
Right.
No, I think I'm talking about comparisons to 2025. The mayor presented cuts between 2025 and 2026. It said it was 2.8 million. Here, I'm looking at the summary tab at the beginning of the spreadsheet, and it looks like the difference between the 2025 budget and the 2026 draft budget is 672,000 in cuts. This is E48 minus B48 for those of you in the spreadsheet. So like that's a pretty big discrepancy, and I'm just trying to get to the bottom. Obviously, I don't want the larger number of cuts. I want the, I don't want you to be chopped up with a chainsaw because you do really important work.
Yeah, I will get back to you on that specific calculation outside of the spreadsheet. As you may have heard actually in other department hearings, like Department of Public Works, there were some shifts in the, well, I would say costs that were incorrectly accounted for in 2025 that we had to use as a proper comparison because we were now in 2026 appropriating it to the right budget lines in the operating budget. So I'm not sure if that is what's accounting for the discrepancy. I can follow up with you specifically for this department.
Yeah, please do, because there's a big difference between 2.8 million and 673,000. Anyway, I just wanted to express my concern, especially if that number is higher, but even if it is the 673,000, I wanted to express my concern on the record that Health and Human Services has been targeted as sort of the butt of these cuts, with 8 of the 31 professional employees being cut from Health and Human Services, with it seeing larger cuts than other departments. And frankly, with the public safety budget seeing an increase of 6.3 million. And going back to what I said earlier, this old saying, an ounce of prevention is worth a pound of cure, is a saying for a reason, because it is much less expensive, it is much less arduous, it is much less painful to prevent something than to deal with the aftermath. And so I would argue even that if, that any reductions in services in Health and Human Services we're going to be paying for in other departments. So I do want to just note that for the record. So.
Thank you.
Thanks.
Directors, a quick question. So we went in quickly on senior transfer, but I do want to thank you for being one of the only departments to take seriously the budget crisis we're in, make those cuts. I know they're painful. You mentioned regional partnerships. Can you speak to 2 things? One, what did you have in mind in terms of with whom? And 2, what departments do you see as being able to merge, rely on other institutions? Specifically, I'm asking things like the county. The county does a lot of the things that our department also does. And maybe there's a partnership there that we can rely on.
And that's actually one of our greatest partners. So we have county workers that are sitting in the annex right now that are providing some of the support services that I would like to continue to build and expand on. So they're there providing SNAP benefits. So the county is one of our greatest partners. And so we'll expand on that partnership and grow that partnership. Also partnerships with Robert Wood Johnson, Barnabas Health, as far as looking at clinical social workers and them supporting us in that role so that we have additional mental health support in our social service space. So that's some of the partnerships that I've been working on and thinking of and looking at and actually been meeting on a regular basis.
That's wonderful to hear. That's great news. What about departments in your in HHS that you can see as, okay, maybe we can make some savings here because another government entity already does this kind of work, and then we can focus on hiring back some of those key positions that are so important to people in Jersey City?
As far as the various divisions, that's all part of our reorg. And so consolidating some of those divisions, which I can't speak to right now because I am in meetings with the law department. So, but the whole reorganization of HHS would greatly, significantly reduce some of the budget and reduce some of the duplication of services, eliminate all of the duplication and just sort of be a more consistent, efficient department.
Thank you.
Mm-hmm.
Any other general questions or on the slide before we move to the division line items?
I have a general question about how the line items are set up, if that's okay. Is the right in between moment to do so?
Sure. Why don't, maybe that's a transition to the divisions unless council members, any other general questions? Okay. Why don't we shift to divisions and I don't know, we start with the director's office or you have a setup question.
If I may, yeah. Just continuing the questions about how grants get reflected and how grant offsets get reflected in here. I just want to be clear for Health and Human Services, but for every department that receives grant offsets, the total draft budget number that we see is the money we are being asked to appropriate for that department minus all of the grant money coming in. Is that right? So the $8,206,222 draft 2026 budget, that is the amount we're being asked to appropriate, setting aside all of the money coming in to HHS through grants. Is that right?
I believe we answered this question already. It includes the assumptions of the grants.
So I guess I'm just not sure how this is adding up then, because those numbers are subtracted in the 2026 draft columns, aren't they? Sorry if I missed
Say that one more time.
The 2026 draft column, in each of the different line items, and like in line item 101 in the director's office, we have some subtractions of $24,000 here, $51,300 there. And that 2026 draft column total, I assume would be everything minus those grant offsets, right?
So in the workbook, there is a list of, for example, all the employees per division and their salaries, and the 2026 draft has that, proposed budget for it. Then at the very bottom of that section, you have a list of all the grant offsets. So that is how we adjust the cost of those salaries, not line by line, but at the bottom of that chart. And again, finance, if I'm explaining that incorrectly, please correct me. Does that make sense?
Oh, okay, so each of the line item grant offsets are reflected back in the other expenses part. Is that right?
Yeah, I mean, we can use one division as an example, but you see each tab of the spreadsheet has a section that is salary and wages, line by line, each employee of that division and their salary, right? And then underneath all of those named individuals, there are rows that are labeled with the name of the grant, and that gets deducted from the total salary of that division.
Okay, I think I still have some more questions, but I don't want to take up the rest of the time, so I'll ask offline. Thank you.
No, and I was just going to follow up. Jake, if you look at, you were looking at line item like 51,300, there's 2 staff members that are listed there, and some of their salary is offset by that particular grant. So that's even more broken down for you if you look in the comments.
Thank you.
Okay.
Thank you very much.
Okay, why don't we start with the director's office? Any questions on line items for the director's office?
I do.
Go ahead.
Am I allowed?
You're making me say my catchphrase. I'll allow.
Director, can you talk about line item 314? There is a significant amount change. When you're there,
That was for professional development, and they were using consultants, and that is no longer the case.
Can you repeat that, please?
That line, the contractual services that you're looking at was for professional development, which was now taken out.
Thank you.
So because it is such a large line item and it's not being renewed this year, are there any, I guess, professional development or any certifications that will be lacking in the department with removing that line?
Not within the director's office.
Okay.
You will see in the various divisions as we go through that they will, for environmental health, they have to maintain their licenses, right? So that those type of things, courses will have to be maintained for licensure. Health educators, certified health education specialists, they have to maintain that certification. So that line item will be in community health and wellness. So you will see them broken down per division, but for us, no.
I have a question related to the salary and wages. In the past, I've asked for the retirements as well as resignations. Also going to add to that, and I'm not questioning anything about just doing the due diligence around this, around any promotions to employees citywide. Again, the promotion is, when was effectuated, any changes to salaries and wages.
Rolando, is that Council Lavaro, is that a specific question?
That's specific to Director Troy for, again, citywide.
Oh, citywide, okay.
So we shared all the data related to active employees for the last 5 years. Your request is also for what time period for resignations and promotions?
Motions in
right?
2026. So 2026 promotions. I previously asked also for resignations and
So since January.
yeah, from January 1, 2026 to present date. Resignations, retirements, adding promotions to the list as well.
Okay.
Any other questions on line items in the director's office?
Just, we talked about the grant offset. So there's several here. And in this one case, it's for the WIC I'm looking at. It lists 2 salaries. Although it's a negative number, I'm just trying to understand what this all means. There's 2 employees' names with $2 amounts, 21,000, 21.3 thousand, 30,000. There's a negative 2026 draft of 51,300. And it's called grant offset WIC. Is it offsetting a salary above? Is that what's, is that?
Yeah, that's exactly what I was explaining, that it is not of us, and correct me if I'm wrong, but it's not of a specific employee, but it actually the employees are listed there, but it's deducted from the total of the salaries above.
It's deducted from what?
The total, so total line item is reduced. The total line item for salary and wages is reduced because of that grant. So in the justifications, it names the 2 employees that are funded by that grant.
But those employees aren't listed here in this director's.
One is,
Is it?
yeah, Cologne is
Cologne
listed.
and
Okay.
Ofer Cohen. Ofer, yes, go ahead.
Cologne is, then Cohen is not.
Ray Colon and I do work that's involved with WIC. So we each have, Ray has, I believe, a $21,000 grant offset on his salary, and I have a 25% grant offset on mine. I'm director of the division, and I'm directly involved with WIC, so it's approved by the state.
Okay. You're in a different department,
No, it's my division.
or a different division.
No, it's my division.
I'm
Yes.
confused.
Oh, none of the
We're
directors.
looking, yeah. we're
Ray is in
looking
the
at-
directors, that's why he's in there.
Okay. And similarly, the other grant, to my point, the other grant offset is, there's a negative on the SPLHI. So my assumption here is that SPLHI grant is offsetting a salary within the director's office. Yeah. It's unclear to me it's being offset as a result of that. along-
Yes, that's a sustaining local public health infrastructure grant, and that is offsetting my salary.
Your salary, okay.
You'll find that the grants throughout our department are offsetting salaries, and they're going to offset salaries in the percentage to which that staff is actually working on that program.
Right.
So like some of our division directors that are managing multiple grants, you'll get 20% off of this grant, 20% off of that grant. So it just depends on how much they're working on that, but the percentage will match what that offset is.
Okay. Thanks.
And I'll just note, once we get to the Division of Food and Nutrition, Mr. Cohen, there's no offset listed in that division. And that's because the offset is listed in the director's office. The BA is nodding for the record.
So Ray, he is actually going to be transferred to food and nutrition, but he used to sit with us in the director's office. He's one of our grant data analysts, but the vast majority of work he's doing right now is in food and nutrition and in environmental. So we're also going to be looking to offset his salary and some of the work in lead prevention.
Thank you. Any other questions on line items in the director's office?
Yes, just, and Director, this may, excuse me, apply to other items throughout the budget, but are there any vehicles assigned to HHS? City vehicles, obviously.
No.
And then every department has a mileage allowance listed. Can you speak to that and where that goes?
The mileage? You have inspectors, investigators that are out every day. You have health educators that are out every day. And so that is where your mileage is. That's what the mileage line item is for.
Okay, and that,
Staff that are working and some are not out every day, but when they do go out for meetings and work-related events,
okay.
that's where mileage comes in.
And in your office, that includes some of the people in the director's office also are on the road throughout the city.
Right.
Just staying with the director's office.
Let me just backtrack on that. I did forget that there is the pool car with animal care and control. So Animal Care and Control Division has one vehicle.
Thank you.
But that's not a vehicle assigned to a specific employee. That's for the division.
Exactly.
Just to clarify, and I hate to beat a dead horse here. The grant offset. So to Councilman Brooks's, yes, Brooks, not Brooke Hanson, Brooks. Point is that, and I'm going out of line, but just to use as an example, as you said, when we get to 331, which is environmental health, there's a large offset of 503,721, which I assume offsets salaries within that division. And it's unclear whose salaries are offset. So it would be good to know just who's grant funded in the list.
Yeah,
That's what I'm trying to get at.
we will work together to provide a list of all the employees which are grant funded and what percent.
And then staying with the director's office again, I brought this up yesterday, and I just want to make the point again, which is that I got this document from Kyle Greaves, the finance department. I kept saying it was you, Ms. Choi, but it was actually Kyle. So the number was for the expended amounts for 2026. I don't know if these are accurate. So if somebody could look at that.
Yeah, I confirmed with Kyle. I saw your email during the hearing.
Yeah.
These numbers are accurate as of the date it was run. So I think it was 2 days ago, perhaps. So it would be accurate of the 2025 expenditures, and the 2026 is up to the date it was run. So it's not
The date it was run.
obviously the full year of 2026 because we have not completed 2026.
Okay, good to know. So I'm just going to go down the line here then. Cleaning and laundry services, again, only $2,500. Spent in 2025 is $475. And then year-to-date, zero has been drawn down on this account. Printing and advertising, 305, 2025, adopted, allocated 20,000, requested 20, the administration said 5. Year-to-date, spent $115. This is not me saying, I've said this in other departments, I'm looking at these, and just to be clear, it's not, look, I mean, obviously, you've already made serious cuts, looking at the every line item, as I promised, to go line by line, and find where there are opportunities to be able to kind of right-size the lines in this budget cycle and season without impacting employees. And so each of these line items, just giving the heads up to, and certainly happy to talk to the director offline. And we don't have to spend hours in this session on this. Compiling a list of these numbers to be able to discuss what would be an appropriate kind of amount as I propose sort of amendments around this. Okay.
Okay, we still have 10 divisions, so why don't we move on to environmental health? Any questions on line items in the Division of Environmental Health?
I had a question on other expenses, line item 308, again, similar to the last division, the mileage allowance, right? Because we're at 45,000 here. And in the last division, we were allocating 5,500. So I guess are all of these numbers, I guess the question is, what are we currently spending, or what's the average that we spend a month for mileage allowance?
I can help out here.
Yeah, you have the expenditures.
I have the number, yeah. So it's 2025 expenditure, $21,260, $21,260. Year to date, at the year to date of the run of this spreadsheet, it's $5,865. So.
And that's for environmental health only.
What did you just come up with, Councilman?
According to the numbers that have been provided to me,
Mhm.
the year-to-date mileage reimbursement for environmental health is $5,865. Yeah.
Yeah.
They're out every day. So you're talking about the Public Health Investigative Senate, REHSs. So they're out daily. They average about what, 132 a month, and there's how many, Amanda? 11? 11 staff times 132.
Okay. Just maybe that is the answer, but if you can clarify item, line number 103, overtime wages. If you could clarify that, please. Line item 103.
Oh, overtime are the events that they have to get to do the inspections, just like for the FIFA was here. So you had staff that are out there. They were a little short staffed at some point, and so that's where your overtime costs would actually come in. Because they were talking about events on Saturdays in the evenings where inspections need to happen and they need to be there. So that's where, when it comes to environmental health, that's where we're talking about safety for food. So anything that's events, festivals, carnivals, they have to either just to ensure that your vendors are operating safely and that there's food safety issues. So we want to ensure that.
And just curious to learn, Director, is it possible that someone who has to be out on Saturday to the events, they can work less number of hours uh, in the week so that weekend can be adjusted?
These are union workers, so we have to follow union policy.
Thank you, Director.
I have a question, keeping on line item 103. Do these inspectors issue summonses, or do they have the capacity to do that?
Yes. Amanda, would you like to speak?
Hello. So yes, the inspectors do have the ability to enforce state codes, local codes, both public health
Just
invest.
pull a little closer to you.
Yes. Is it better? Both REHS inspectors, public health investigators, and the lead inspector, they all issue summonses.
Okay, so it's potentially revenue generating if code is not being followed.
Yes.
Councilman, if I may, so the fines that are collected from citations which are issued go into the general funds. They will not appear in our budget. I'd also just like to note in terms of the overtime for the inspectors, with the FIFA events, some of that was recouped by grants that the city received from the state. And our department also received a small grant to cover overtime for just the month of June related to all the extra activities. So that's partly offset.
Thank you. In line item 101, could somebody speak more about, is it the childhood-led poisoning and prevention program?
Yes, but what are you interested in?
It's a large number.
Yeah.
Yeah.
Yep. So it's a large number, and it, like many of our grants, the number reflects mostly staff. As childhood, whenever a child in Hudson County is tested and found to have an elevated blood level, it's the responsibility of the health officer and the health department of that child's municipality to address that, both in terms of treatment and also in remediation of the condition. Our office, our program is granted this money from the state, and we cover case management for the entire county, and we do remediation and investigations within Jersey City. So we find the source of the lead poisoning. And while the child is in treatment, we try and eliminate that until they are down to the level which is considered acceptable. There is no safe level of lead for either children or adults, but it's a special concern for children because of the way lead affects development, especially brain development.
Thank you. And line items 312 and 314, it looks like 314 contractual services, 20,000 adopted in 2025. And then, or I guess what's the difference? And then there was nothing allocated for either line. Yep, 312. 312 is professional services. Around 20K was requested, but nothing was allocated. And then 314 contractual services, 20K was adopted last year, but nothing was requested this year. And I guess what's the difference?
Sorry, I have the spreadsheet up if you need to look at it. So it's not in the current budget, but I think the question is what was intended the funding to be used for? And if we don't have that information, we can get back to you.
Okay, great. Just to keep things on time, any other questions for this division, or can we move on to disease prevention?
If you could speak to the line item 104 union allowances as to what that is used for?
Oh, no, sorry, we're still on.
All right, finance might be
environmental
able to
health.
answer that question.
Councilman Navarro, your question was line one.
Line 104 under environmental health.
Thank you.
Afternoon.
I wanted to go to disease prevention, but Councilman Navarro wouldn't let me. Yeah.
Hi,
Go
those
ahead.
are contractual obligations,
Contractual obligations,
uniforms.
paying for uniforms. And I see year to date, we've spent you're at $970, same as last year. Are we anticipating additional expenditures at this point because it's budgeted for 6,000?
There's additional staff that we have with environmental health. Right, so they have to get uniforms.
So it's for the purchase of actual uniforms, is that right?
Yes.
So the additional staffing requirements, I guess if you could provide then a list of the number of staff and the cost per uniform, and then we can kind of right size that and figure out what the number is.
Okay.
So I will try to do that.
Is that a request for information?
Yes, that's a
Okay.
request for information.
Okay.
So
Be able to.
it's being used for uniforms. Would like to know the number of new people that we're going to be looking to provide uniforms for.
I'm gonna speculate, and obviously the administration will get back to us, but from my union background, the way union allowance provision works in a contract is the employee has to submit. And so if they don't submit, they don't get the money. So, Division of Environmental Health employees, if they don't submit for the allowance, then they won't get the money. I'm speculating. I don't know, but, and the VA will provide the information, but I'm speculating that perhaps this could be to cover the potential for the request.
Look, I'm not singling out HHS here. Right? So we go through budgets year after year, the number rolls over, literally the same number was expended last year that's been expended this year. The amount that was adopted last year is being proposed again this year. And my point has been that in a budget crisis, we can't do business as usual, right? We need to look at these things and question the idea of whether this is truly a necessary expenditure. And again, if it is, then we have to right size it and make sure that we're putting the numbers correctly before we lay off people, before we raise the taxes on anybody else here beyond the 50% that they've gotten in the past 5 years, and that we're already inflicting upon them with the 15% and or 12% at the municipal level that we approved for the third quarter. So I'm just doing what I said, we just go line by line. And so I'm happy to work with everyone, this department as well as future other departments, as I've said in every meeting. We're going to scrutinize each of these lines and just make sure that the money is necessary, because literally once it's in the budget and approved, that means it's on the taxpayers' backs. So.
Councilman, to just address the uniform issue, first of all, it has been the practice of the department to purchase the uniforms and distribute them to the employees, so it's not reimbursable. It is actually a required expense because it is in the union contract. What is not necessarily required is the dollar amount. So there.
Yeah, I'm not disputing whether it's required or not. I'm happy to ensure that we fulfill our legal obligations and our contractual obligations with union members. Just questioning whether we need to spend not whether we need to spend, whether we need to budget $6,000.
Yeah.
And we're spending historically $1,000 or less.
I think I'm going to take that back because it's a question of budgeting, not, not expenditures.
Okay, thank you. Why don't we move on to, we have 9 more divisions to go, so let's move on to disease prevention. I have a question on row 13 of line item 101. This position was terminated, but was this a provisional employee? Director said yes. Okay.
Yes.
And rows 17 and 18, could you speak to the permitted uses for these funds and how they are being deployed?
17.
You're talking about the grant offsets.
Yes.
These are grants that are covering the entire operation of STDs. It's paying for staff and it's also paying for supplies. It's an annually renewing grant.
Thank you. Any other questions on line 101?
On that note, with the termination, you said that the clinic is reduced to just daytime hours now. So, did you also say that it's there's no longer walk-ins being accepted, or that was a different division?
No, right, that's a different division. That was for environmental, for our licensing. That's where there's no longer walk-ins and it's by appointment only.
So there are still walk-ins available at the clinic despite the
Yes.
termination?
Yes,
Okay,
but the hours just have been reduced.
okay, thank you.
To the BA in finance again, line 212, recreation and education materials supplies. It's on the division worksheet, budget worksheet. It's not in this document here. So I want to point that out.
Sorry, say that one more time.
Line 212, recreation and educational materials supplies.
Yes.
It's on the division of disease prevention's budget worksheet,
Yes.
but it's not on this document that Kyle Greaves shows the expenditures.
It may not have been spent. This is what you're referring to is a document that lays out expenditures.
Yeah.
So
There are lines in here that have zeros across the board. So there are lines that have no expenditures. And
So those advertising expenses is about outreach and STD education. And we actually just made an encumbrance with an advertising company. So you might have an old expenditure report, but we have spent money against that line item. And that's STD awareness and to let people know they should get tested.
Yeah.
And where they can do it.
again, I'm not questioning the necessity at all. I'm just pointing out a discrepancy in the numbers to the BA in finance because it's the documents that they provided us.
yeah, we have finance. Maybe you should sit at the table.
The reason you don't see the line item on the expenditure report is because it has not been created in Edmonds. So there is no activity at this time.
When you say not created in Edmonds, I don't know what that means.
So the program we use is Edmonds, our financial program, and we create accounts within that program.
Okay.
So this particular line item has not been created as of yet. Does not mean it will not be created, but that's why you don't see it in the expense report.
Okay.
The expense report is generated by the Edmonds program.
That's correct. I'll also say it doesn't mean that it's not accounted for. It just may have been accounted for in a different line item, and we're trying to clean that up.
Can I ask a question about item, I just lost it. Oh, there it is. 312 professional services. So Dr. Gonzalez, about $80,000. What is the work of Dr. Gonzalez? And
So that $80,000 covers several things. It covers his authorization for the nurses and the other staff to do their work. He signs off on all the medical orders. He issues standing orders for treatment, which is provided for STIs and also for vaccinations. So it covers his time to oversee that, and it's absolutely required in order to do that work.
So the administration has zeroed out that line item. Does that mean there will be no more STI screenings, no more vaccination clinics?
no change.
Oh, I'm reading it wrong. Sorry. Okay.
I will just say, as the health officer, if there is no doctor to sign off to issue the standing orders or to sign off on treatment, we cannot provide it. So.
I was looking at the wrong column. I apologize.
I guess this is an example of where trying to bring these services in-house would be more costly, because we could be twice, 3 times the amount to have a doctor on staff full time. Just having one contractually hired to do this limited scope of work is a lot more cost effective for us.
Correct. A full-time doctor is not needed for our operation. It is a professional service. It doesn't need to go out to bid or to be competitive, but it is possible that there might be other doctors able to provide the service. But Dr. Gonzalez has served the clinic well, and has served the city well too, because also the work he did during COVID, he performed the same service he performed much more service at the same rate.
Thank you.
Chairman, if I may.
You may.
Thank you. I promise I'm looking at the right column this time. So for line item 314, that was zeroed out. This was contractual services utilizing opioid settlement funds. And I understand the opioid settlement funds do not come at a cost to the taxpayer because they are from the settlement. You requested 43,000 for this, and the administration zeroed it out. So my question is, if these are coming from settlement funds and not from, I guess my question is twofold. If these are coming from settlement funds and not out of the taxpayers' pockets, what was the rationale for zeroing that out, first of all? And second of all, if my memory serves me correctly, I believe council has voted on items. Council has voted to approve contractual services utilizing opioid settlement funds, if I'm not mistaken, earlier this year already. So has some money already been spent here, and would 0 be an inaccurate number?
So the number that's getting zeroed out would have been city contribution, and we are making up for that with opioid dollars, using dollars that are allowable. This is covering our risk reduction kiosk. And so it was city dollars that we lost, and we made that up with some remaining opioid dollars for this year.
Okay, great. Thank you for clarifying.
And so where does that show up with so utilizing opioid settlement funds for the kiosk rather than operating dollars? So where does that show up in our budget that we have access to?
Yeah, I believe that's a separate document which we can provide from finance.
Please.
Okay, any other questions on disease prevention? Nope. Okay, why don't we move on to Community Health and Wellness Division. Go ahead.
Director, the budget has significantly changed from 2025 to 2026. Can you please explain that? Talking about community health and wellness.
We've actually cut a significant amount of our operating expenses. There's also, we lost a staff member. And so that's where the greater reductions are. And there's also been a reclassification, reclassification that needs to happen. So there's additional dollars that you may be seeing that need to be reclassed to a different division. And that's in progress.
Could you just,
Thank you.
would you, oh, I'm sorry, Councilwoman Singh.
Go ahead.
Would you speak to some of what is being lost through the $25,000 reduction in the recreation and educational materials and supplies, please?
What we're actually having to scale back on is some of our language educational materials. So we're reducing the amount of educational materials that we're purchasing because we have to. So we will always have information and education in various languages to address the various languages that are spoken here in Jersey City. And so we've had to cut back on some of those educational materials.
Are those like books, booklets, pamphlets?
Right, we're in schools, so we have educational materials on your chronic diseases, on information that, and education, on various mental health, substance misuse, and we like to provide those because it's important to provide those in languages that speak to the diverse population, right, that we have here in our city. And so we've had to cut back significantly on ordering those supplies.
Just on that point, Director,
Right.
but we can still continue digital version. That would not cost us anything.
Right.
We
And
can
so
post about it.
we're supplementing with some of the digital versions. But you may not have the same
That's-
information, right?
That is
And
true.
so, and because it is health education, we have to ensure that our sources
Yeah.
are credible. So even in ordering or using digital, we're making sure that it has to be something from CDC or American Public Health Association, or, so it has to be those type of resources that we're using.
So this division, has lost 5 people. Is that correct?
No, this division lost one health educator.
One health educator. Okay.
And there was a position that has not been filled. So there was a Ward C health educator where that seat had been vacant.
Okay.
And then the Ward A health educator was just terminated.
And if I may, also your position is not being backfilled as well, your former position.
Right. My position as division director is not being backfilled. Absolutely.
Thank you.
Mhm.
Chairman, if I may.
Go ahead.
Thanks.
Not waste valuable seconds. We have 18 minutes. I may make a motion to extend, but go ahead.
I would second that motion. If people have the availability to stay a little bit longer, I know with DPW, we stayed till 12:30 just because it was another large, complex department such as yourselves. So the city had previously explored establishing a sort of a mental health first responders program and had at the time allocated and set aside, I believe encumbered 1.2 million for this purpose. They put out RFPs and this was, I believe, in 2020, end of 2023, beginning of 2024, if I'm not mistaken. And Jersey City Medical Center submitted a bid, and ultimately that bid was voted down because the community felt that it was not comprehensive enough. It was, I think, for 5 days a week, 8 hours a day, and people felt, especially the Justice for Drew Coalition, felt that, and I agree with this, you cannot schedule a mental health crisis, right? Drew's crisis happened on a Sunday, and this is not a 9 to 5. Mental health is not a 9 to 5 thing. So the community asked to put out the RFP again at a later date. Council at the time, I believe, was told that there was approximately 3 million being carried in reserve for mental health crisis response. I understand funding for the Arrive Together program does not sit with Health and Human Services. That sits with Public Safety, but I believe this was something separate. It was for mental health first response when the person experiencing the mental health crisis was not posing a safety threat to themselves or others. So situations that might not even need to involve the police because there's no threat to safety. It's simply that they need a mental health crisis response. And, I'm just hoping to inquire of the BA about the status of these funds, if they are still set aside for it, where in this budget that we might be able to see them, and if we can move forward with this, because the intent was never to vote it down and then not have a mental health first response program. The intent was to vote it down and build a better mental health first response program. And so, I would hate for this to turn into a situation where council at the time inadvertently made the perfect the enemy of the good.
Okay, I can speak to some of this, not all of this. I know what you're speaking. I remember the RFP going out. Medical Center was not awarded, and I believe another RFP went out. I was under the impression, and I'm saying this, that this was awarded to a nonprofit, or am I speaking about the wrong monies?
So the Jersey City Anti-Violence Coalition Movement received a 2 million grant for a community-based first responders program through the Seabrooks Washington Act grant funding, but that was separate. It was not. And my hope is that, maybe the city could collaborate with them and find some areas where we could work together with them, but that was Seabrooks Washington Act.
Councilperson, if I may, 'cause I worked on the initial RFPs. I think that the $2 million which went to Jersey City Anti-Violence is the money that was originally viewed for this kind of program. And the number, in fact, came out of community dialogue from Jersey City together with council candidates one election cycle back, as a commitment that several council people made for funding. The problem with 24-hour service for this kind of program is $2 million would not cover that. There's no way it would fit in. And the first proposal was rejected because the number proposed was out of line with what the city thought it could afford. And then the history on the second proposal. And I believe that the concept of $2 million was then transferred into the funding, which went in the direction of Jersey City Anti-Violence. So to the best of my knowledge, there was never any budget provision for a new program beyond that.
Okay, just to clarify for the record, the Jersey City Anti-Violence Coalition Movement funding is from the state. So the city did not have anything to do with them being awarded that grant. But so I think that is separate. I don't think it is that the city moved the money around and issued a grant to the Anti-Violence Coalition Movement that was issued by the state. And in fact, the city had applied for Seabrooks Washington Act grant funding, and the consultant at the time had botched the application, and the city did not get awarded any Seabrooks Washington Act grant funding from the state.
I'd be happy to be corrected on that. But going back to the original question, to the best of my knowledge, there was never a line of funding for this. Had the RFP been approved at whatever level, the council would have had to allocate funds for that.
Okay, so this money does not exist.
The best of my knowledge, going back to the original concept meeting and RFP process.
That's disappointing to hear, but thank you. I appreciate it.
Any other questions on Division of Community Health and Wellness?
Yes. I just want to point out again, the expenditure report shows line 212, 214, 304 and 309, $0 expended to date, year to date. So just want to bring that to your attention. And we'll
Continue.
follow up with you on that offline, but
You can, because there has been, prereqs just went in. Things have just been ordered. They were operating off of a temporary budget, as you're aware. So things, the actual orders have just been placed and are going through.
and I should add that the 2025 expenditures show that's been spent in the past, or a certain amount has been spent in the past, but I'm not suggesting that there's not going to be money spent, but I wanted to bring that to your attention. On 304, the rents, this is tables and chairs. We just met with the Office of Cultural Affairs yesterday. We talked about tables and chair rentals and things like that nature. What kind of coordination do we do with them? Because they have a supply of that.
What was normally done in the past, and I can speak to this, is that normally we would go to cultural affairs. But over the years, our events have grown in size, the number of attendees have grown in size, the number of participating agencies have grown in size. And so cultural affairs, and depending on their competing events, the city is busy, we're active. And so they may not be able to provide us with what we needed. So I had to build into my budget over the past few years, the ordering of tables and chairs, just because the city doesn't have the capacity to provide with all the events that we have at one time.
Right.
These are for all, of course, outdoor educational events where we're offering free resources, free health screenings, because we're partnering with our medical facilities and partners. We have agencies that come out. We do food distribution. We partner with, we provide that to our community. And so we're meeting the basic needs of people at outdoor events. Our last event, which was just National HIV Testing Day, there were 38 different agencies on site to provide free services. So as the needs of the community grow, our events grow, our partnerships have expanded over the years, and they are working with us to provide and bring services to our community. So that's why there's a rental, because we never did that years ago, but it had to happen because cultural affairs just can't meet the need and the demand that we have.
Right. And they also rent because they don't have enough chairs to meet the demand that they have, as was pointed out in yesterday's hearing. And so we haven't yet gotten to recreation, and I don't know what they need for their events, but given all of that, I think it wasn't my idea. Somebody, I think maybe it was Councilwoman Singh who suggested maybe we should be buying more tables and chairs at this point if there's a need evident to do that, rather than continuing to spend on rentals.
We can definitely take a look at that analysis. If we buy more tables and chairs, we'll also have to figure out storage.
Exactly, that's what I was about
Management
to.
of
Yeah.
yeah.
And community health and wellness has approximately 4 to 5 outdoor events per year where there's a need to rent.
Can I just add something, Director Green? I'm not saying this year I have seen it, but in the past year, I've seen HHS table giving away a lot of goodies to families, to kids, even pet owners. I think that is something I do not see where it is placed in the line items, but that is something if we can eliminate, just a suggestion, or maybe you have already done that. I have seen it, so based on my experience, I'm sharing it. Something to keep in mind if possible.
Okay. So you're saying eliminate like the actual, you're saying promotional items or what?
Goodies like, there were some small plastic toys or something like that.
Incentives, educate.
Yes.
Certainly. Normally what we do is we, some of the promotional items that we get are like the ice cold packs. Those are good for our seniors. See, we try to make sure that whatever we're purchasing as far as promotional and incentives, that it's something that can be used across the spectrum. Now, what we have done, because we're in the schools, We have provided journals. We purchase journals because what we're finding is that as far as mental health, it helps when young people are able to sort of write and source and journal. So we purchase those things in bulk. And sometimes we get sponsorship. But so those, I mean, we're looking at additional sponsorship. We do get sponsorship for some of our food distribution. So we don't have to purchase as much as we normally would have to purchase. But these are the things that you will see. So no, that's why there is a reduction, because we know that given the fiscal crisis that we're in, we cannot provide all that we would normally provide for the community.
Thank you, Director Green.
Yeah, just a quick time check. We have 7 more divisions and my Sean, how you've changed. We lost Sean. Hi. To respect everyone's time, what I would propose is that we extend to 12:15. We do senior affairs and animal control. And then Director and BA, would you be amenable to another hearing? It probably may only take an hour. Later date.
I defer to the council president in terms of coordinating with other council members. I can work with the director in terms of scheduling.
We'll coordinate. We have to coordinate public safety.
Could be the same day.
We will coordinate additional sessions.
Thank you, Council President.
Oh,
Okay,
that's fine. Yes.
thank you. All right, why don't we move on to, and apologies for the divisions that we didn't get to today. Thank you for preparing. We apologize. Division of Senior Affairs. Before we go into the line items, I did just want to, I had a question from a resident about outreach to seniors that don't live in senior housing complexes. If you could talk about how you outreach to seniors that are not in those buildings.
Thank you. I do have a group emailing of seniors I have about 75 different groups, and any senior leader that wants to be part of the programs. They may be individual seniors, the church groups, the senior housing. Just the senior says, can you just keep me updated? And I keep the regular emails for them. But I have to say, we just did a big grant, age-friendly grant, and we realized that a lot of the seniors, their biggest complaint is that we're working on now is that everything is computerized, that everything's on social media. They can't get permits unless they're on the computer. So we're working on a program this fall, just real fast, to have a teacher seniors technology. We're going to partner with the schools, have the schools and the seniors be partners. So after the class, if Mary Jones needs help with an application, they're going to have a student that she can call.
Go ahead.
If I can add one other thing, last thing about the buses, I forgot to say before. Just so you know, in March, we had 211 on trips. In April, we had 231. May, we had 300 seniors on trips. In June, we had 220. So that's a lot of people that will be affected by this. Those are the actual numbers.
Nice. Yes.
I think we agree, Joan. I think it's, we got to figure out how to get that bus system back going.
Okay, just a general question about senior affairs?
A general question.
About senior affairs? Okay, go ahead.
Are there any other services for seniors eliminated other than transportation we know?
Well, we have the big thing is the 2 senior centers. Because the one in the Heights now, yesterday they had over 100 people for lunch. So we do a lot of that. We do transportation. We're going to update our directory, getting the information for them. And we're just going to try to do more programs for the seniors that can't get out to the 2 centers. Because we really should have more than 2 centers for the whole city. Oh, pardon me. We do senior photo IDs up at the center where you have their name, their address, their emergency information, any medications they're allergic to. And we just are wrapping up our farmers market program where eligible seniors can receive up to $40 for the farmers market. But the numbers have been down the last couple of years because there's no markets in A and F. So because of that, we were cut down to 2,000 seniors. So this year, we gave vouchers out to 2,000 seniors, and we have 500 on a waiting list at this point. So as soon as we get the vouchers, we're ready to get them right out to them. And the biggest thing with seniors is word of mouth. So if you tell one senior, they'll tell everybody else. So that's how we get the word
Yeah.
out a lot of times.
Communication is good there. Thank you, Jim.
Thank you.
Councilman, may I ask questions?
Sure, we're on line items or not quite yet?
I'm looking for if there's something in the line items.
Yeah, okay.
I'll give you
Getting
that.
warmer.
Yeah.
Go ahead, yeah.
Director, it's a privilege having the Connor Center in the Heights. As I said before, thanks for your work there. My understanding was that the work at the Connor Center, and particularly the lunch program, is federally reimbursed or federally funded. Is that reflected here in the budget workbook?
The meals are under food and nutrition.
I see.
They're federally funded, trickle down to Hudson County. So a portion of the meals are funded and a portion are funded by CSBG.
So those county dollars, federal dollars to the county dollars to not to senior, but to food and nutrition. Is that right?
We collaborate at Maureen Collier and Joseph Connors. They are congregate sites. We work with Joan's staff
Right.
at those sites, and then we have others.
Okay, so that's reflected in your budget as opposed to Jones. Okay, thank you.
And with the county funding, anybody that goes on a bus, anybody that takes a class, anybody that comes to the center, they get an entry, and then we have to enter them into the system, and that's how we get reimbursed. So we have really good records on how many seniors we affect every day.
Was that only from the out of city trips or is that from in city trips as well?
Everything, out of city trips, inner city trips. They come, any activities at the center, any presentations at the community health one, any way we touch a senior with information, we get credit for that.
Okay.
So I just want to piggyback off of what Joan said. Any social engagement that the seniors have is what is reimbursed. Because we know that, first of all, that leads to healthier seniors, seniors that live longer, they're more active, they're more engaged. So senior affairs is more about social engagement for seniors. And so that's why it's important that we have these services in place because we want to keep our seniors healthy.
Thank you.
Okay, why don't we start with line item 101, salaries and wages?
We're still in senior affairs, right?
Yes. I have a question. So there was a net increase from 2025 to 2026 of, let's see here, on the wrong division. There we go. $23,000. And so that encompasses some salary, it looks like union mandated contractual increases with some of the employees that were laid off. That's accurate?
Yes.
Okay. And the job title clerk driver, what's that role encompass?
That's the official title for any of the bus drivers with a CDL license, a CDL passenger endorsement license.
Got it. Okay. Anything else on 101 before we move on? Okay, why don't we move on to line 102, part-time employees. Okay. Any questions on line item 103, overtime? Okay, moving on to the rest of the line items. I have a question on line 212, I think maybe this was already covered, but what are some of the what are some of the supplies that would be encompassed in?
A lot of them are just giveaways for special events and things. That's why we had cut those. That's been cut down from what it was in the past.
Got it. Okay. And 305, significant reduction in printing.
Yes, we used to print the senior directory outside, but it was up to like $3, up to $2 a book. So now we're able to print the directories with in-house. We're going to try to get as many copies as we can.
Thank you. Any other questions on other line items in this division?
Just a comment on mileage allowance. So it appears there's mileage allowance across divisions. Does HHS have access to our fleet of vehicles for employees to do their work?
We normally have not reached out for vehicles. I know the director's office has a vehicle on standby, but I've not utilized that. So for basically, no, they'd use their own personal vehicles and get reimbursed mileage.
Maybe something to look at in terms of cost effectiveness, whether using the fleet of vehicles as opposed to, and this is the time of processing someone's mileage, things like that, right? So.
Just, you know, it's hard for us because we're at a different location. We're up in the Heights.
What's that?
We're up in the Heights. And the other office is on the other side of town. So that may be.
Trying to get to the vehicle, you're saying?
Okay, anything else on this division?
What are some of the contractual services lost in line 314?
There for all of the instructors at the two senior centers. We also have a program twice a week during the school year at New Jersey City University, where the seniors can swim for free and walk for free. So that's including NJCU, all the instructors and the lifeguards. And then this fall, we're going to be doing more instructing with the technology. So we'll be having more instructors. And even though they're at the centers, anything is open to the whole city.
The reduction in $35,000 is reflective of it. Even though we have more events upcoming and more instruction upcoming in these different areas, where it's going to be less than it was last year. Is that?
Well, a couple of our instructors had canceled out, so that's why we're still trying to build new instructors.
Thank you.
If I can comment on that line as well, just so the expenditure report I've been referencing. So in 2025, approved or adopted for that line item, 125,000. According to this expenditure report, and that's why I'm asking about the validity of the numbers, it's $4,650 spent, according to this report. That line, 314 for senior citizen affairs. And then the mayor's budget comes in, 90,000 year to date on this report, $707 spent year to date. So I think there's definitely probably either some right sizing in order or the numbers are not being accurately reflected. So
Just to be clear, the actual expenditure number that you're looking at is correct. It comes
Okay,
straight
that's fine.
from the system. But in terms of the budgeting part of it, yes, I agree. We could take a closer look and see if we are budgeting it correctly.
and I'm fine with that. We can definitely budget that. Get to have to sit down with you, Joan, on that one. All right.
Anything else on this division?
Yeah, I'd just like to note that the printing and advertising budget was cut from 20,000 to 2,000. I'm assuming that has already been spent. Can you talk a little bit about what printing and advertising was used for? And my concern with this 90% cut and essentially zeroing out of this line item is that many of our seniors are maybe not as technology savvy, if you will, and flyers can really be the best way to reach them. So is that something that we are at risk of losing?
This is, as I said before, we used to do calendars for this, pocket calendars for the seniors, but we just cut that up. We're going to still be doing the directories because but we can do them in-house and save a lot. I mean, it got up to $3 a copy, which was absolutely crazy. So we're going to be doing that inside, but we are looking, as I said before, part of that whole study we just found out is we want to do more with the flyers, with actual printed materials that was requested by all the seniors. So the director and I had met and even spoken with the mayor's office about eventually getting more print things because seniors just aren't on the internet at all. Their complaint is everything's on social media. So we are working on doing a more paper-friendly paper.
Okay, so it's just being brought in-house. Okay, thank you.
Okay, last call for senior affairs. Moving on to animal control. Okay. I have a question with regard to the doctor of veterinary medicine. So this position was hired midway through the year. Is this a position that you anticipate requesting for funding for 2027 as well?
Absolutely, yes. This has been our dream since the day we knew we had to open a shelter. Having a doctor of veterinary medicine on staff saves us money. We spent much more money last year providing less service. So this gets her on site 2 days per week and on call the rest. And it greatly, first of all, lets her take care of almost all of our shelter animals, except for emergency situations. And it also allows her to expand our spay and neuter operations, the community for outdoor cats. And we're certainly looking at the ways in which we can further support the residents of Jersey City through services and supplies, which will help keep pets at home rather than force a surrender to the shelter when people are having economic difficulties. So this is part of the long-term strategy. If we could have 2 of her, we would, because it pays off.
Thank you.
Director, we spoke, I'm sorry, I got something else. Director, we spoke months ago about streamlining hires for the animal shelter, because by the time Director Burns gets someone who's willing to work and do much needed efforts at the shelter, they have to go through HR and there's a huge process. Can you speak to any steps that were taken to alleviate that issue?
Right now, we're currently, we lost an animal attendant. So during this most recent round. So now we're looking to see how we can better support that. So we're just having conversations because we are now back to where we started. There were some that were hired, but then we lost one. And he was the most senior person who, even though he's provisional, that had the experience. So this has been a constant struggle with this division and trying to find a like you say, a more streamlined way to get staff on board. But what we're realizing is that you might interview someone and then they start and then they realize that the scope of the work is greater than what they anticipated. So now our onboarding has to be more of, interviewing has to be more of like, okay, you need to come in and see what you're actually going to be doing and what the work that's involved so that you're not so surprised when the work actually starts, right? We have to do better. We have to get better at that process. And so now the director and I are meeting and looking at ways to sort of help that process along, because this is an area where you have to be fully staffed.
Agreed. Yeah.
Okay, when you're dealing with animals, you're talking about dangerous situations. It could be bites, it could be whatever. And if you notice, we didn't get there yet, but we're going to certainly look at overtime cost, right? And then the amount of dollars that are spent in overtime because we are so poorly understaffed, greatly understaffed. And that just it increases the liability for the city. If people are not there, right, and they're overworked, they're not going to be as, they can't because they're tired. And so it would be very prudent to ensure that this one division is fully staffed, fully functioning with trained individuals who know how to deal with animals. Because the majority of the animals coming into the shelter may not be always Shih Tzus and your smaller breeds. As you see, we do have an Adopt under the Big Dog Days of Summer campaign going on, trying to get the larger dogs adopted, because that's a lot of what we're seeing coming into the shelter.
That,
So it's imperative that people are trained.
that's what I'm referring to. So really cutting out HR out of the process, because it'll be Director Burns, it'll be the people at the shelter who know who's really qualified to do the work, less so someone downstairs. No disrespect to anyone working in HR, but Director Burns will have a better sense of that. And the BA and I spoke about that as well. Is there any process?
No,
It'll be unique to animal shelter, yeah.
I wanted to speak directly about HR since it is under the Department of Administration. I think, you know, there are many, many components of HR, human resources, and there are different challenges depending on what you're hiring for. So I know we're talking about HR much more on Monday, but just to clarify, we will make sure we're streamlining the hiring and processes. However, we always rely on the departments to review qualifications for job descriptions and interview candidates and select the proper candidate to be hired. That is not the job of HR, it's the job of the departments. So I think what Linda's talking about is more of a recruitment challenge, similar to what we've talked about with other departments where it's really hard to find the most experienced person who's willing to take the job with the pay that we're offering. And if it is an HR processing problem, then I will definitely take it back with HR and we can talk about it. But I just want to clarify what problem we're trying to solve.
Thank you. And it goes a little bit into my next question. So Director Green and I, we agree that this is an area where you need people who take care of the animals, to pick up the animals off the street who've been abandoned or need rescuing. And then, of course, making sure that we have, we're promoting the animals to be adopted to loving families. So in that regard, can anyone tell me what a systems analyst does at the animal shelter? In furtherance of the goals of protecting the animals, feeding the animals, promoting the animals.
No, and that way they can track the animals, they can do the data for the division. They can ensure that those that are being adopted, they can keep reference to that. So that's more of an administrative role than the actual physical operations of the.
So in terms of administration, we have
coordinating position.
We have a systems analyst, clerk 2, chief clerk, and of course our division director. And they're making quite a bit of money. So I just want to. Well, one is our systems analyst showing up. Is he working every day and doing those things?
He is.
Okay, good. That's great news.
He is doing a lot of interface with the public. This is adoption coordination, foster coordination, which is also helping us take the burden off the shelter. We can keep these animals in the house. That's, you know, a success for us. And there's also an awful lot of fiscal work that needs to be done with the shelter because we're dealing with large contractual purchases. So this is not just a $6,000 PO. These are huge contracts that we have to get through and maintain and pay down. So there is a lot of administrative work. It's not just walking animals.
No, of course. I know I've visited quite a few times, and it needs a lot of work. Okay, just want to make sure that the people on the administrative side are doing are filling the gaps that are needed.
Are we on item 101 still? Okay, I had said we would try to wrap up at 12:15. Can we? I don't want to shortchange questions, and I'm taking up time by rambling. Councilmember Singh, go ahead.
No, just, and thank you. So this is a very successful division. And just want to, if you can talk about your plan to share services with neighboring municipalities?
Yes, so we currently have contractual shared services agreements with Hoboken and Gutenberg that brings in over $112,000 a year. We are the only municipal shelter in the county. And so our idea now that we have an in-house vet is to expand animal control services throughout the county. We know that other cities are having similar problems with animal care services. It's all privately contracted out. We work really closely with a lot of cat colonies throughout the city, and this is what's made our TNR so successful. I certainly have seen it on my block. I was at a dead-end block. I can really see the impact on it. And so this will allow us to work with other cat organizations in different municipalities, bring those cats in for spaying and neutering and charge a, per cat price. So our original projections show that we can pay for this salary and then some by expanding this.
Yeah, that's the hope, right? We will be able to take care of the salaries. Thank you.
With those shared services, that's us supporting other municipalities, right? There's no municipality that is supporting us, even though those municipalities are paying for those services. But we're kind of the big kahuna in charge of helping other municipalities, right?
We are providing the service to them and we are compensated for it. And we
Right.
regard this as a good deal because it's a service they are required to provide.
I'm not saying don't get the money from the other municipalities that we're helping. I'm just saying there's no wiggle room for other municipalities to really help us and have us reduce a service.
In this area, no. They help us with funding because we are charging them less than it would cost them to do on their own. And I'd say that our per service cost for those municipalities is less than it is for serving Jersey City. So it's a good support for animal care and control.
And then I have a question in regards to, and I realize these are probably two very different roles, but I see two funded new hire positions in the budget, one full-time and one part-time. In this division, lost an employee, but it was a clerk 3 position, and two positions that we are looking to hire for are animal attendant. I'd imagine those are two different roles, but have we looked to see if the terminated employee has any appetite to fill those two new roles?
With this current budget, we don't have the capacity to fill those two roles right now. So that's why there's 0 out and there's nothing there.
But the roles are included in the draft budget. So you have a vacancy for an animal attendant that's being funded in the budget.
I think we're looking at full-time versus part-time.
There's one in full-time. There's a vacancy in full-time, and it's being funded in this budget for $46,000. A replacement for Mr. Reyes.
I think that's what we were talking about with Councilman Zupa in terms of challenges with hiring.
Right.
Sorry, can you repeat the title?
It's for an animal attendant. So the terminated employee was a clerk 3. So I'd imagine those are two very different roles.
Absolutely.
But,
Absolutely.
I don't know if, I'm just trying to think of ways to save from people who were terminated. If we're creating two new positions and we terminated one, there might be wiggle room to bring that person back.
He was terminated.
She's saying
Okay,
might be.
so he wasn't laid off? It says terminated 7/10. That's when we
He
did.
was laid off,
Okay.
right? It was
Say that again, I'm sorry.
So I think we should, we can take this back. What I think is the case here, which Director explained, is that there are clerk titles that do administrative work. There are titles that are specific for handling animals.
Right.
So I think there may be a difference here in responsibilities, but we can take that back and talk about it separately.
Okay, anything else on 101 before we move on?
Yes. So I noticed you have the vacant position that you are still attempting to hire for animal attendant. You also requested, f- and you also have a vacant animal attendant position that's part-time, so one full-time, one part-time. You also requested 2 full-time animal attendants, 1 full-time animal control officer, and 2 seasonal animal control officers that were denied by the administration. Given that we are now bringing in these services or providing these services to other municipalities, can you speak to, what sort of shortfalls would be encountered given that the funding has not been assigned for these positions? And can I, I guess as a follow-up to that, were these line items zeroed out because of difficulty filling the positions and the fact that maybe we were not optimistic we could fill them before the end of the year, or were they zeroed out for budgetary reasons?
So it's my understanding that there are budgetary reasons. And as was discussed earlier, the animal attendant workforce in particular is different from most other places in the city. And even if we're hiring as full-time and permanent, it is a transient workforce. It's tough work. It's not highly paid. And we know from other shelters, we know from the nonprofit shelter which preceded us here, we know from other shelters around the state that it's a transient workforce, and we just have to be prepared for that. What I am most concerned about as a health officer is how close we are running to a point where we open ourselves to problems. So somebody calls out sick, we have 1 less person to clean the cages. We have 1 less person to handle the animals. And the more that happens, the more I think we expose ourselves to problems. So this is certainly a place where I think the additional revenue from expanding shared services would certainly be very helpful and should go straight back into a more robust level of staffing here in the animal shelter. By the same token, the clerk that we lost as a layoff in terms of adoptions, it's a really simple business. Every animal that comes in has to go out. And the quicker we can move animals into their permanent homes, the better off it is for the animals, for the family that receives them, and for our operation.
Okay, anything else on 101? Okay, let's move on to, I think we did address 102, discussing the vacancy, and 107. Anything else on those items? Okay, how about 103 through 105?
I have a question on 105. Can we just explain the purpose of the line item? I know we have seen this in other budgets, and I know it's not being funded, but I want to make sure that I understand what the acting position costs line item entails.
So I believe this is a employee in 2025. In previous years. So it's not in our budget for 2026.
Correct, but would that cover acting position costs? What does that line item mean? It's in several different budgets.
So I think we discussed this. It's specific to the director of the division. That is the line item for acting position costs.
Okay, I just wanted to make sure that I understood that. because we did discuss it briefly yesterday, I think, in the mayor's office.
But,
budget.
my understanding with, I'm learning a lot about the budget myself, is that this is specific to the head of the division or department.
Okay, so you can't use it for staff. It is only when there's an acting for the director.
That's correct.
Hello, Councilwoman. So 105 is across the board, citywide, acting position costs. So take, for instance, if an employee is on vacation or some kind of leave,
Right.
another employee jumps in to take a responsibility, so they're being compensated.
Correct. So any employee, it doesn't have to be the director.
That is correct.
Correct. So that goes back to my point that I was making yesterday during that budget hearing is in other, for consistency purposes, my point is for consistency purposes, in other budgets, we have this acting position cost line, but in the mayor's budget, this was not utilized. So I just want to make sure that we're being consistent across workbooks so that we aren't confused as a council, not confusing the public, and that we are doing proper accounting work when we're in these budget hearings.
Yes, and I apologize for getting that incorrectly, so thank you. We did also discuss with the mayor's office that we were correcting that workbook, so you'll get an updated version of that.
Thank you.
Okay, moving on. Anything on line items 201 through 312?
Just a quick question on item 309, food and meal. 6,000 to requested 36,000. Line item 309, food and meal.
It's under control.
So this is the food that is, it's under contractual, first of all, because it's with
Yes.
the food for the animals. In emergency situations, we need to be able to go out and purchase. That is what that line item is for.
Thank you, Director.
Any other questions on the remaining line items? Okay, I think then we're going to call it for today. We have 5 more divisions. Council President, defer to you on when we can reschedule.
Okay, we'll definitely look to reschedule. I didn't realize we still had 5 left.
What's that?
I said, I didn't realize we still had 5 divisions left. You have a large task in front of you, Director.
But
Thank you, everybody.
I'll get done, but thank you very much.
Thank you.
Thank you.
Okay, motion to adjourn at 12:31.
Motion.
Second.
Motion made by Councilperson Singh, second by Councilperson Efros. Motion to adjourn at 12:31 PM. By acclamation, please say aye.
Aye.
Thank you.